Hello, welcome back to the TMI Club. Today we're going to be talking about birth control. I have with me nurse practitioner Erin from Planned Parenthood Toronto. And I'm Erin, I'd love to have you introduce yourself.
Hi. So my name's Erin. Like you said, I'm a nurse practitioner at the youth clinic here in Toronto. We deal primarily with sexual and reproductive health. I'm really excited to be here and chat about all the TMI subjects.
Yeah. I'd love to start off with what are the different types of birth control out there? And could you give a little description of each one?
Yeah. So the way I like to talk about it is there's kind of three different categories of birth control. So the first one is your non-hormonal options. So those are typically ones that need to be used on demand. So every time you engage in sexual activity. So male condoms, female condoms, spermicides, sponges, diaphragms, and then as well as the copper non-hormonal IUD, which is a small little T-shaped device that gets inserted into the uterus and stays there for 5 years. And it works by physically killing sperm as they get into the uterus. The next category is progesterone-only birth control. So there's no estrogen in this one for those people who can't have estrogen for whatever reason or don't want to take it. There's one type of birth control pill, which is a small little pill that you take at the same time every day. There's the Depo-Provera shot, which is the injection that you get in the, you have to come to the clinic every 12 weeks to get the injection. There's the Nexplanon, which is a small little plastic rod that gets inserted in your upper arm here. That's good for 3 years. And then there's the hormonal IUDs that, again, they go in the uterus and they're good from 5 to 8 years. Those work primarily by thinning out the lining of the uterus so that an egg can't implant into it. And then the final category is the estrogen and progesterone, so the combination birth control, which is probably what we're all most familiar with. So that's your birth control pill, the birth control patch, which is a small little sticky square that you stick on an area of your body and you change it once a week. And then there's the Nuva ring, which is a little plastic flexible ring that you insert in the vagina, leave there for 3 weeks, take out for a week, and get your period. And those ones all work by thinning out the lining of the uterus a little bit, but also preventing ovulation.
Yeah, it's awesome that there's so many different options. And what I'm thinking is, as someone that's interested, where's a good place to start? How can we best educate ourselves and decide what's best for us if that's something we want to get into?
Yeah, that's a really great question. Talking to your healthcare provider is always a good place to start if you can get that appointment. There are lots of good websites out there. So Planned Parenthood Toronto has informational fact sheets as well as links to other sites. Itsaplan.ca is a site run by the Society of Obstetrics and Gynecology, and they have, again, a ton of information on those options. And what I really like about that site is there's a little quiz. So you answer some questions, what's most important to you, what do you want to avoid, and it kind of helps to narrow down options for you to help guide you in the best direction.
That's awesome, very specific, I like it. And then what is the best form of birth control? And is there such thing, or is that subjective?
That's a really good question. It is very subjective. So any of the forms that I mentioned there, if they're used properly, can be over 90 to 95% effective. The key is whether or not you can use them properly each time, right? So anytime that you are going to use a male or female condom, you have to put that on properly at the beginning of sexual activity and wear it for the whole time and make sure it doesn't break, hopefully. If you're going to take a pill every day, you have to take it at the same time every day, right? So there's various different options, and it also depends on how your body reacts to the different options, the different hormones, and what fits into your schedule. So I know when I was nursing and doing 12-hour hospital shifts, I could not take the pill. I could not for the life of me take that on time. So I had to think about other options that were easier to use in those schedules. So short answer, no, there's no best form of birth control. Long answer, some of them have higher rates of success because they have less that you have to do with them, like the implant that goes in the arm or the IUD that goes in the uterus. You come in once, we put it in, and then you don't have to think about it for years.
So you mentioned those two examples. Could you name another, and as well as one that may not be as successful as you said?
Like another longer acting?
Yes.
Yeah, so the Depo-Provera, the shot, so the one you have to come in every 3 months for, or even the Nuva ring where you're only changing it you're putting it in once a month and taking it out once a month. It just decreases the amount that you have to remember to do.
Right.
Whereas the birth control pill,
Yes.
you do need to take it at the same time every single day for it to be effective.
Yeah.
If you're more than an hour or two late, it can really decrease the effectiveness.
Yeah, and I remember a lot of friends talking about IUDs, for example. As you said, they are more likely to be successful. However, pain is always a topic that comes to mind, especially when I talk among friends. So can you talk a little bit more about people saying that getting an IUD is very painful, and is that true?
Yeah, no, that's a great question. And yes, I wish I had a better answer than that, but yes, it sucks. It's very crampy. It's something going through the cervix when the only thing that's meant to go through the cervix is a baby, when your body's had 9 months to get ready for that to happen. And even then, that's still very painful.
Yeah.
But there are varying degrees of pain, because everybody has a different pain tolerance. So some people might describe it as just uncomfortable, and some people describe it as the worst thing they've ever had to go through, and that's totally valid. But there are lots of things that we can do to help with pain, and I am a strong advocate for this. I think it's really barbaric to just say, don't worry, we'll just put it in, you don't even need anything, you can take a Tylenol after. That's not accurate for most people. We can prescribe better pain meds to take ahead of time. We can freeze the cervix now, which is something that we do in our clinic, which is kind of like when you go to the dentist and you have your gums frozen for procedures. We can do that around the cervix, which helps to decrease the pain. And then there are clinics in the city who use, blanking on the inhaled analgesia, like a nitric oxide type of medication. Unfortunately, those aren't covered by OHIP, so they are
none
covered
of the ones
by
that you mentioned.
The pain medication that I can prescribe and the one that we can inject, we cover those in our clinic, but the inhaled nitric oxide is not covered. So if you have private insurance, it can be covered. Otherwise, there is a bit of an out-of-pocket cost, but it is very effective at helping with pain management. And I would love to see one day that would be covered as well.
Yeah, and what would be a good sign going into a clinic and asking them about these pain management options? Is it good that is mentioned at the forefront? Because I have a lot of friends that halfway through the procedure, they realized there was an option for pain management, yet they weren't educated on it coming into the clinic.
Yeah, so good signs, I think, are clinicians who are very upfront about it, and they're honest. Like, this procedure sucks. I say if men had to do it, it would be under general anesthesia, I'm sure. But there are, if you're open about it and you counsel people on what to expect, typically that can help a lot as well. And sometimes a lot of the pain is just due to anxiety because you don't know what to expect in the procedure. And it is a very invasive, intimate procedure. So especially for people who've maybe never had gynecology exams before, they may not be comfortable with even just the start of the speculum, right? So if I would say a good sign is clinicians who talk about it openly without even have to ask. So that's part of our routine counseling when clients come in. One of the things we talk about is pain management and how we can help that specific person, because everybody has different needs.
And what about costs? So compared to the list of birth control that you mentioned at the beginning, what would be the most affordable versus the most expensive?
Good question. So the most affordable ones tend to be, okay, I'm going to caveat this. The most affordable short-term options tend to be the ones like condoms or spermicides that you don't need a prescription. You can just pick up at Shoppers or Rexall. I'm not doing a plug for either of those. Or you can go into sexual health clinics and they have condoms for free, right? Then you have your birth control pills and the patch and the ring, which all range from about $10 to $25 a month, depending on the brand that you're going to pick. And then you have your Depo-Proveras, about $35 to $50 a month, depending on which pharmacy you get it at. And then you have your longer acting ones. So your Nexplanon and your IUDs can range anywhere from $300 to $400. A high upfront cost, but if you have that IUD that's good for 8 years, that works out to be a lot less over the long run. But understanding that that's not feasible for a lot of people to do right away, there are certain programs that can help fund long-term contraceptions as well, and they're typically through the company that makes the the IUD and the Nexplanon.
So would you recommend going to the websites of these IUD companies that create them for these funds? I've just never heard of them.
Yeah, they have to go through a healthcare provider.
Okay.
So I would have to apply on your behalf.
Okay.
Which some people, like some clinicians, if they don't do it often, they may not be aware of it. So always something really good to bring up is like there are funds out there if you go through the company, and they give away a certain amount each month, which is wonderful if you can't afford that upfront cost.
Yeah.
Oh, and then sorry, if you have OHIP plus and you're 24 or younger, the IUDs, the Nexplanon, the Depo-Provera, and most of the pills are covered under that as well. So you can get them for free if you're under 25 or 24 and under.
Wow.
Doesn't cover the patch or the Nuva ring.
And would you just go to the clinic with your OHIP card to get that done?
Yeah, and you can just get it. You can fill it at any pharmacy, and they'll run it through OHIP plus.
And is there a legal age to be able to purchase any of these birth controls, or depending on the birth control?
There is not. That's actually a really great question. There is no legal age of consent in Ontario. So as long as you are deemed capable of consenting to the procedure or the medication, so you understand what it's for and the side effects and risks that you might be taking, there is no like minimum age that you have to be. We can prescribe it and you can pick it up.
Wow. What about male birth control? Can you tell me a little more about that?
Male birth control is in the works, is my understanding. Typically right now, the only ones that are really available are the male external condom and the vasectomy. So a semi-permanent, it is often reversible procedure where they can cut the vas deferens and you don't produce sperm anymore. So there's the male condom and the vasectomy, and then my understanding is they are in development of male birth control, like a male birth control pill, but as far as I know, it's not passing the trial stages of side effects because there's too many side effects.
Speaking of side effects, I would love to talk about the female birth control and the side effects that someone may feel. Of course, it depends on which birth control they take, but do you have a quick overview of some things people can expect that are normal but are things that people should be cautious of?
Yeah, definitely. So just like you said, everybody reacts differently to every different type of birth control, including different brands of birth control pills. So you may have different side effects depending on which one you take, but the most common ones for estrogen and progesterone, so that category, tend to be things like headaches, mood swings, so really bad PMS swings up and down. No, I don't like that phrasing. I don't like that. So headaches or like mood swings around your cycle. You could be feeling more angry, more sad, more joyous. Sometimes I've had people described varying different degrees. Acne could get better, could get worse. Breast tenderness, especially around menses, is often a big one. As well as some spotting in between cycles you might notice. Typically, those go away in the first 2 to 3 months once your body's gotten used to the hormones, but for some people, they may last longer. Weight gain and hair thinning are also a possibility with those ones, but they tend to be a little bit more with the progesterone-only ones. So progesterone-only ones tend to be weight gain, acne, mood swings, headaches, as well as some bleeding in between periods. Again, because it works by thinning out the lining. So you're just kind of constantly shedding the lining of your uterus in the beginning. Super annoying, but very expected.
So it's normal to spot when you first try that specific type of birth control.
Yeah, it's absolutely normal to spot in between your cycles. Typically for combination ones, that should level out, again, 2 to 3 months. For the progesterone only one, can take up to 6 months before that lining is really thin.
So at what point should we normalize these conditions or question whether or not we should change our birth control? Because I have a lot of friends that would just normalize these severe mood swings or weight gain and say it's just a part of the process.
Yeah, so at any point in time, if it really affects your daily living and you're unhappy with it, come back and see us and we'll change it. I'm not gonna tell anybody to ride it out if it's really affecting their life. But that being said, if it's manageable and just kind of bothersome, I do recommend trying the 3 months for that combination and the 6 months for the progesterone only, because we can see a sharp decline in side effects at that point in time. And then there are things that we can do to help with that, right? Like there are other lifestyle changes or medications that we can use. If you're spotting in between your periods, we can always try something else to help get rid of that as we're waiting for it to level out.
And is there a relationship between period cramps and birth control? Because I know a lot of friends also go through extensive pain. Sometimes the pain, again, is all subjective, so it can be severe or minor. But is there a correlation to helping manage pain through birth control?
Yeah, so that is one of the indications for birth control is management of dysmenorrhea, which is painful periods, menorrhagia, which is extremely heavy, like lots of bleeding periods, PCOS, so polycystic ovary syndrome, which they often have, very heavy, very crampy periods, or endometriosis, which is, again, associated with lots of heavy, crampy periods. The birth control helps to thin out the lining of that uterus, like we said, so that helps to typically decrease bleeding and cramping long term. Sometimes, depending on the type, like if you have an IUD, you're going to have a bit more cramping in the beginning as your body's getting used to it. But long term, most hormonal birth control does help to thin the lining and make periods lighter and less crampy.
So would you say birth control should be the first option when it comes to potentially painful periods? I'm thinking of kids in high school, for example, if they're going through quite a heavy flow or they're experiencing a lot of pain. Where's the first place to go? Because I understand birth control to sometimes be the first front solution.
Yeah, I mean, birth control is probably I don't want to say easiest, but like most common, fastest method, right? We can put you on birth control and typically periods will get better in 1 to 2 months, which is ideal for a lot of people. But those who maybe don't want to take the hormones, there are other options. There are medications that you can take during your period to help decrease the bleeding and the cramping. There are pain management options that we can give people depending on their medical history and what other medications they're taking and things like that. Birth control is often pushed as a first line option for that because we know it is very effective and it has the added benefit of being birth control. So if you are sexually active and you're not ready for pregnancy, we want you to be on something reliable that can also help manage periods.
How many types of birth control should I try?
Well, never more than one at once unless you've talked about that with your clinician. But sometimes it really is trial and error. So there's no limit. Like I myself have been on almost all of them I've tried over the years. And I've had clients who've tried all of them over the years for various reasons, trying to figure out what works for you. It's a long, annoying process if you're giving everyone a try for 3 to 6 months before you find the one that works for you. But usually if you're willing to chat about it and be upfront about what you like and don't like about the first one that we try, we can help guide us to what we're looking for. I like to think of it like you're shopping for a pair of jeans. You're going to try on 20 different pairs of jeans and they're all going to fit slightly awkwardly, and then you're going to find that magical pair and you're going to buy 20 of them and be super comfortable with it.
So is it normal for that the first birth control type that you try, it may not work?
It's not abnormal. Like I've had clients be on the same one for the last 10 years because it worked for them and that was all that they needed. And then I've had clients that we've had to change multiple different times to figure out what works best. So definitely not abnormal. Don't be discouraged. It's really frustrating, but we can often find something that works well for you. It's just a matter of trial and error.
And what are some ways to manage that frustration, that when one doesn't work out quite the same way you want to, when you spent a bit of money on it, how can we manage those emotions? Because it, again, is attached to something that is quite vulnerable and intimate part of our body.
That's a really good question, especially if you've shelled out a couple $100s for an IUD or an implant and it's not working. I always encourage people when they're starting out birth control, be super transparent about the side effects and the possible side effects and the timeline for them getting better. Oftentimes people might, your provider or the birth control companies might have sample packages that you can try. We have a couple that sometimes we give out if people are worried about interactions and how they might feel with them. So you can try one for a month and see how it goes, right? And kind of go from there. be gentle on yourself.
Yeah.
It's not your fault. It's nothing that you're doing. It's just how your body reacts with the hormones. And each different type of birth control is a variation of a synthetic hormone. So they're not all the same. They are simulating the same hormones, but they're all slightly different.
Yeah, I think that's such an important mindset to go in, is that you're trying to help your body versus fighting against it and feeling like there's something wrong with you and that's something that has to change. I feel like having that mental shift allows more ease when it comes to things not working out the way that you want it to, especially when it comes to uncertainty in birth control.
Yeah, especially when you've had your friend is on this birth control and they've been super happy with it and they love it, and then it does not jive with your body. That's okay. We just have to find the one that does, and that's not through any fault of your own or your body. It's just your biochemistry and how it reacts, and we're all different.
Yeah, I love touching on that point, especially because a lot of people feel it's just physical, but there's so much psycho and emotional aspects that comes to taking it on, not just from symptoms, but in general, and why you're using it in the first place.
For sure.
I know that sometimes birth control can get a pretty bad rep, whether it be from what you were told when you were younger, or maybe it was religious or cultural upbringing. What are your thoughts on that?
Birth control has changed a lot in the last couple of decades. I mean, I've seen it change in the last 5 years that I've been practicing. So, your parents' birth control is not our birth control anymore. It is different. And it's hard because it doesn't always jive well with certain people. So there are side effects to it. Just like any medication that you might take, there are potential side effects and risks. It's not perfect. It'd be great if there was a perfect solution out there, but it's not, and we're still working on it. But overall, it's better, in my opinion, than an unplanned or unwanted pregnancy. And that being said, we just have to find, again, which one works best. Overall, I'm a big fan of birth control. That's why I do what I do. But I know that it doesn't always work for everybody.
And I have a quick question. I know there's a method where you just pull out while a penis is potentially ejaculating inside a vagina. People also have mentioned pre-cum as well. Can you get impregnated with pre-cum?
Yes, you can. There is sperm in the pre-cum. The withdrawal method, so the pull-out method, it can be effective if you combine it with some other methods, so like fertility awareness methods, so tracking your cycles, knowing when you're ovulating, and avoiding intercourse at that point in time. There is sperm in the pre-cum, so you can get pregnant from that. And if you don't pull out in time, or if your partner doesn't pull out in time, then they've ejaculated inside of you, and that increases that risk as well. So it does. It's not the most reliable method.
And if, for example, your hand has pre-cum on it and it is inserted inside the vagina, is that also, I'm assuming, a way to get pregnant as well?
Any sperm that can get inside the vagina towards the cervix has the chance of getting pregnant.
If I choose to stop taking birth control, how long will it take for my body to get back to its normal state?
Yeah, that's a good question. It depends on the type of birth control, because each one is going to have a different half-life, meaning the time it takes for the hormones to fully leave your body. So birth control pills on average have a half-life of about 24 to 48 hours. So I'm not very good at math. I'm not going to get into the full how that breaks down. But a couple weeks typically, and the hormones should be cleared from your system. Typically, side effects like acne might take a few weeks before you notice that's improved or gone back to your baseline. Weight gain, if that was one of your side effects, obviously that's going to depend on how much weight and what your lifestyle is to help get back down to your baseline weight. But typically within a few weeks, the hormones are gone and the side effects should be settling back down. And in terms of fertility, there actually is no delay in return of fertility for almost all of our methods. You could theoretically get pregnant the same day that you stop. I have seen it happen. So it is possible. On average, takes about 4 months from when you stop any type of birth control, which is equivalent to stopping using condoms, just kind of the average amount it takes. That being said, the Depo-Provera, the injection, that one does actually have a bit of delay in fertility, just the way that it works with ovulation and thinning out the lining of the uterus. So the delay can be about 9 months to up to 2 years. So for those who are hoping to get pregnant quickly or in the not too distant future, I don't often recommend that one.
So it's important to plan, especially when working with, for example, folk like you at the clinic, where if you're planning to get pregnant over the next 2 years, maybe a year, being conscious of which birth control to take.
Yeah, exactly. And that's always a good discussion. Depends on your timeline and how important it is for you to not get pregnant before that timeline.
So I would love to learn more about the fertility awareness method.
The fertility awareness method can be super effective if you use it properly. It is not for everybody because it does involve tracking either one or a number of different things. So there's a couple different methods you can do. If your cycle is extremely regular, like you are on that 28-day cycle without fail, you're always regular, then you can typically know that your window of fertility is around day 11 to 16, roughly. Then you can also do temperature tracking, so you can check your basal temperature in the morning, and go based on what that reading is, and it'll tell you when you're most fertile. You can also do the cervical mucus tracking, so your mucus changes throughout your cycle. You've probably noticed it gets a little white, little thicker around the time that you're ovulating, so you can keep an eye on that as well. If you use it properly and you have a regular cycle and you have a partner who is willing to abstain or use condoms during the period that you are fertile, then it can be a really effective method. It does take quite a bit of dedication, though, to do properly.
And does it only work for folks that have their period consistently?
It does, unfortunately. It's not as reliable for people who have irregular periods, just because we don't know exactly when you're ovulating, and the mucus and the temperatures may not be completely accurate if it's not a regular cycle. It doesn't have to be 28 days. It can be 30 days or 26 days or whatever is regular for you, as long as it's regular.
And is it okay for our periods to change? Because I know you said consistency is something that can happen for certain menstruators, but for other maybe irregular. Is it okay to have irregular periods?
Yeah, absolutely. Most menstruators, when they first get their menses, are irregular, and that's super normal as we go through adolescence and into early adulthood. For some people, it will regulate after that. For some people, it won't, and there might be underlying medical reasons for that, right? Polycystic ovary syndrome, endometriosis, problems with thyroid, or a number of other things that can cause irregular periods. But it could totally be normal for you. And if you've always been irregular and you're continuing to be irregular, then that's just your normal. If you're regular and then you become irregular, that checked out to make sure that there isn't anything wrong with your thyroid or other factors like that.
And what does it mean when you say going from regular to irregular? Is it a difference in 2 days, 3 days? You miss it for 2 months? What does that quite mean?
Great question, yes, thank you. Typically we define it within 7 days. So if you were 28, you have that range of like 21 to 35.
Yes.
I'm not too worried about that, still pretty regular. Number of factors can affect that. But if you're all of a sudden like 45 days, and then you're 21 days, and then you're 3 months, right? Like that you would want to chat with someone about. And again, if that's what you always were, then that's just normal for you.
And if you were concerned per se and you want to go to clinic and get it checked, what would that procedure look like? Would it be invasive? Would it just be them asking about your history, what you've been up to lately?
Yeah, so a lot of the time it always starts with just a conversation about what triggered or what may have triggered it, your lifestyle factors. Oftentimes we find stress is a really big factor for irregular periods, and people may not realize how much it can truly change your period, and you can skip months or like delay of several weeks, and it can all just boil down to being very stressed out with work or school or family or whatever it is. But based on the history, then we can do a couple of other tests. So those typically could be blood tests, if we're looking for things like hormone levels or thyroid levels or iron levels, things like that. Or it may be a ultrasound, which could lead a little bit more structural causes of the irregularities. Ultrasounds can be done over the abdomen, so they're not as invasive. They don't always give the best picture if they're over the abdomen, but they can be done. Otherwise, they can be what's called a transvaginal ultrasound, which is a probe in the vagina. it sounds exactly as uncomfortable as it is, exactly as uncomfortable as it sounds. It does give better pictures though.
Yeah.
But that's always a conversation with the clinician and the ultrasound tech on whether or not you're comfortable doing that. And it's not necessary for every single case.
Okay. And is there anything else to touch on that we may have missed in this whole discussion so far?
Any type of the birth controls that we talked about today, aside from external and internal condoms, do not protect us against sexually transmitted infections. So please always use condoms for that purpose. Yeah, I think that's it.
All right, Erin, so we have a little rapid fire round. You just have to ping me true or false based on each of these statements.
Okay.
Are you ready?
I'm ready.
All right, so first one, hormonal birth control protects against some STIs.
False. Against no STIs.
Point blank period. Hormonal contraceptives can affect your libido.
True.
Emergency contraception is the same as the abortion pill.
False.
Hormonal birth control methods always prevent ovulation.
False.
Birth control pills need to be taken at the exact same time every day to be effective.
True.
IUDs need to be removed by a healthcare professional.
True, they should be, yeah. You can remove your own IUD, but I don't recommend it.
Hormonal birth control methods can lead to weight gain in some individuals.
True.
Emergency contraception is only effective if taken within 24 hours of unprotected intercourse.
False.
And last one, there is one best form of birth control.
False.
I actually have a question about what you said about the taking the pills not at the exact same time. What happens when you don't?
Yeah, so it depends on the what pill that you're taking, but typically you have a window of either like half an hour to about 2 hours, depending on the pill, and you can chat with your provider about which one you're taking. If you're outside of that window, it just becomes less effective. So it goes from being like 97 to 98% effective to 80 to 85, even lower, depending on how late you are or if you're missing pills. So if that does happen, if you're late in taking it or you missed a day completely, take it as soon as you remember and use a backup method like condoms for 7 days.
For 7 days, and then just continue though taking the pill at the same time.
Yeah.
Even after. Okay. There was also one answer that you gave me that was very interesting about libido. Could you explain more about how hormonal contraceptives affect your libido, and also what isn't libido for those that don't know?
Yeah, so a libido is your sex drive, basically, your desire to have any type of sexual activity, and that may vary from person to person. Hormonal birth control, typically the progesterone ones, are often what affect libido, and typically by lowering it. So the androgen suppression that progesterone gives on the ovaries, which means it decreases our production of testosterone, which anybody who's born with a uterus still has testosterone in their body, just not as much as those born without. But testosterone is typically what drives libido in most people, so a suppression of that will often result in a decrease in the libido. And for some people, again, it may be transient, a couple months as their body's getting used to it. For some people, it might be for the whole time that they're using the birth control. For some people, may not notice it at all.
And are there things that people can do if their libido happens to go down with birth control, yet they do want to increase their libido?
Yeah, so not so much in the way that there's like something that we can take that would just increase libido, although maybe a naturopath might be might have a better answer to that question. But oftentimes it can be about practice makes perfect, right? That saying where if you engage in intimacy with your partner, starting that process can increase the libido. So I'm not saying do anything if you're really not in the mood to do it, but if you're looking for an increase in libido and an increase in your sex drive and your sex life, that just starting off, and whether that's alone with stimulants like pornography or with your partner, it can often increase the libido in that moment. As far as I know, there isn't anything super great that's going to just increase your baseline libido if it's suppressed because of birth control. But exploring the intimacy aspect can often increase it.
Yeah, and having that conversation with your partner even before taking the pill and saying this might be a symptom that may happen. Are we okay with this? And do we have a plan to help manage if that is the case, that the libido happens to go down?
Absolutely, yeah. I think it's always really great if you can chat with your partner about the birth control that you're starting and the side effects that you may experience, because sometimes they can be, they can affect other people, like the libido, or you know, if mood swings and you're like, I don't know why I'm feeling like this. Okay, remember it was the pill that you're starting, so just give it a give it a few weeks and hopefully that'll settle down.
Well, Erin, it has been such a pleasure to have you on here and talk about hormonal birth control. I certainly definitely learned a lot. And thank you to the viewers for also tuning in. If anyone has any questions about Planned Parenthood in Toronto, we'll leave those sources down below. Thanks, guys.